third-party statements, people verifying. Some judges might defer to those and be like, oh, okay, your neighbor said, your daughter said the same thing. They're giving credibility to your statements. Whereas another judge can just be like, well, they're biased, they're your family, they have an interest in you getting awarded benefits, right? So one judge can look at abnormal physical exam findings, and you could have tenderness, spasms upon examination. You could have, abnormal range of motion. You could have, abnormal gait, you're not walking right. Sometimes you even have to use a cane, etc. So one judge can look at that and be like, oh, well, this is clearly evidence that you're limited to seated occupations. You can't do jobs that require you to do standing and walking far, or, what they call postural activities, which is like ramps and stairs and twisting and bending, etc. Right? So one judge might be like, okay, yeah, those exam findings support that. Another judge can look at the same evidence and say, oh, well, but on this day, you didn't have a problem walking. And on this day, there was no tenderness on exam noted. So I guess you could do a light level job. So there's no specific criteria when it comes to how they look at, they have to consider it. But the way they consider it varies greatly between different judges. Same with MRI findings. You see, or really any diagnostic findings, right? Or even surgeries, how they look at surgeries, or anything, any evidence. One judge can look at it and an MRI and be like, okay, it's moderate stenosis. That does support difficulty standing and walking, as you said, for long periods of time. Let's see, you have these disc bulges here that supports, what you're saying about needing to sit and stand and alternate positions, where another judge can look at the same evidence and just be like, well, over here, this doctor, said that you didn't complain of pain when you went to see them. So regardless of your findings and telling me you have pain today and you telling this other doctor you had pain, this doctor you went to and you didn't mention it. So I guess it's not that bad. So that's what we're dealing with. This is what really happens.